Our mandate as a ministry is to make sure that every Namibian has access to quality health care. And especially now that we are moving towards universal health coverage and are also now living in the fourth industrial revolution.
Since the system went live, people have really adopted the system with full force. In the initial, I think the first few days, a lot of people were resistant, but since then, especially at my institution, the staff had really just flown with it and everything is going according to plan. I think there is room for improvement, but definitely the ease of the system definitely makes it better.
So it does not only benefit the patient, but also the healthcare providers, because instead of picking up the phone, trying to reach out to the other doctor to get more information about the client, the information is there on the system and you can look for it yourself. So it's making things really very easy.
No longer do we have to say that patients lost their images or the images aren't retrievable and requiring repeat imaging. So now we know it's all available at one site.
The most efficient and effective way of service delivery, and this is one of the methods or models that is enabling the ministry to make sure that we really move towards not leaving anyone behind when it comes to accessing healthcare services.
Because now we can see, we can track disease progression or improvement once treatment has been initiated. Patients are able to get reports much quicker than in the past, and that also directly impacts on immediate management in patients.
It's a dream that has come true, and we will keep on expanding and improving and upgrading our service delivery, because we are just doing this for the sake of the Namibian nation.
So now with the new system, with a digital registration, it's much easier to recall patients' previous studies as well as information regarding patients' contact details and also demographics regarding the patient. Moving from a manual process to a more digital process, that has significantly changed workflow. So radiographers now don't have to enter all the necessary demographic information on the modality, because that has already been preloaded prior to the patient arriving to a specific modality for the investigation.
Patients really have to travel long distances to reach the nearest health facility. So the dream is to have this type of system in most the regions of Namibia.